A strong cardiovascular system and good circulation are essential in our sport. I'd like to give you some medical tips. Tip number 1, stay hydrated. Blood is approximately 50% water. Walking around in a state of dehydration thickens the blood, leading to suboptimal circulation. The heart has to work harder to pump the thicker blood around, and it's much more difficult for the blood to circulate. Tip number 2, maintain a low-fat, low-cholesterol diet. High-fat, high-cholesterol diets promote inflammation throughout the body, including the lining and walls of the arteries. They also promote clogging of the arteries, including the coronary arteries, which supply oxygen and nutrients to the heart cells themselves. Tip number 3, if you smoke, consider quitting. Smoking promotes inflammation throughout the body, including the lining of the artery walls, and thickens the blood. This leads to suboptimal cardiovascular health and suboptimal circulation. Tip number 4, monitor your blood pressure at home when you wake up in the morning with a home kit. Keep it around 120/80. Chronically elevated blood pressure promotes arteriosclerosis, hardening of the walls of the arteries. And the heart, the pump, has to work much harder to circulate the blood around against an increased pressure. This leads to suboptimal cardiovascular health and suboptimal circulation. Tip number 5, consider engaging in an off-mat strength and conditioning program on a daily basis. Strength and conditioning programs promote excellent cardiovascular health and good circulation. Tip number 6, if you work a sedentary job, consider getting up and walking around on a regular basis. Training jiu-jitsu for an hour a day and then sitting 23 hours a day for the rest of the day does not promote cardiovascular health or good circulation. Tip number 7, consider laying on your back and propping your legs up on a wall for a few minutes at least once a day. The large veins of the lower extremities, the legs, rely on a series of one-way valves to bring blood back to the torso and the heart against gravity. Propping your legs up on a regular basis will help promote good circulation, as that stagnant blood and other body fluids can be pulled back into the torso area by gravity. Tip number 8, after discussion with your personal physician, consider supplements that promote cardiovascular health and good circulation. The B vitamins, especially B3 niacin, is an excellent anti-inflammatory vitamin. Omega fatty acids, CoQ10. The dosage of these supplements will depend on your age and medical conditions. Tip number 9, consider seeing your physician for yearly labs. Labs to include ruling out anemia. Anemia means less red blood cells circulating than the normal range. As the red blood cells bring oxygen to all tissues of the body, being anemic leads to suboptimal cardiovascular health and suboptimal circulation. Platelet count. The platelets are one of the factors responsible for clotting the blood if you accidentally cut yourself. Walking around with extra platelets can make the blood thicker and lead to suboptimal circulation. Ruling out prediabetes or diabetes. These conditions lead to inflammation throughout the body, including the lining of the walls of the arteries. A lipid panel, total cholesterol, bad cholesterol, the LDL, triglyceride levels, HDL, the good cholesterol. Elevated LDL, elevated triglycerides lead to inflammation of the lining of the walls of the arteries and promote clogging of the arteries. Thyroid function. Thyroid is one of the drivers of metabolism. If you're hypothyroid, your metabolism has slowed down, leading to suboptimal cardiovascular health and suboptimal circulation.